I'm delighted and honoured to be here, and it's actually fine to say that twice, and to have this chance to reflect on what we learn when we bring mental health and homelessness together, what a deeper understanding of mental health brings to both analysis and action on homelessness, exclusion and inequalities, and I guess to think about what mental health can contribute to the struggle for social justice. That is our underlying theme today, and of course has been in your conferences over the past 3 years. Colleagues, at just a few months old, the human baby is already making valiant efforts to mimic the expression on mum's face. Those almost imperceptible grimaces are mimicry to establish the social cues, the social connections on which that baby's survival will depend. Recognise me, I'm like you. That baby's efforts are a reminder that we depend on each other and that human beings are profoundly, quintessentially social. The world we experience, the people we find ourselves to be, arise from our social relationships. Hence the importance of the factors that structure how we are with each other, our position in society, what we call the social determinants, the work of Michael Marmot, Danny Dorling and others, the distribution of power, privilege and wealth. Colleagues, there's a wealth of expertise and experience and knowledge here in this room and goodwill, and over the next 2 days we'll be hearing many inspiring examples of good practice and indeed of transformational change, as of course you did last year and the year before that. And yet we can probably agree that on almost any indicator that matters to us, on homelessness, on inequality, on poverty, on exclusion, on precarity, things have got worse. So how can a mental health perspective, a psychologically informed perspective, make a difference to some fundamental questions? Deep in our hearts, how do we explain why things are the way that they are? And what is it we believe that we're helping people with? How we answer these questions will guide both who we work with and what we do, perhaps with some surprising results. I did not hear the bird sounds, they had left. I did not see the speechless clouds. I saw only the little white dish of my faith breaking in the crater. I kept saying, I've got to have something to hold on to. A lack of something to hold on to is a central experience of social exclusion. And this lack can structure if, when, how people access and use services. And yet, of course, many safety nets, those things to hold on to, are being removed or their legitimacy and public support for them undermined. Mental health, the think, feel, experience, interpret dimension of our lives. The think, feel, relate, make meaning part of what it means to be human, the emotional, the spiritual, the voices in our head, dream world, vision world. Psychologically informed environments, whether in a hostel, a prison, a police station, on an acute psychiatric ward, aim to respect this most complex dimension of the human condition. Where does it hurt in my soul? A reminder too that the major challenges we face are neither biomedical nor technical, but human. So let's reflect for a moment on what we all need for our own mental health. We need to be heard, believed, understood, respected. But of course there are profound inequalities, aren't there, in whose story is heard, whose truth believed, who feels understood. And perhaps the deepest and most painful inequality is in the distribution of respect and the mental health impact of this on individuals, on families, indeed on whole communities. Homelessness and the experience of psychic pain and dislocation that we call mental illness aren't random. They're linked to the story of our lives. What seems irrational, behaviour, beliefs, attitudes, ways of being, makes sense when we hear the whole story, The most important part of Woolly Hat Day are the stories. Of course, our stories are individual, unique, but they're also collective. When we say the personal is political, that's what we mean. Our stories as Roma and Gypsy travellers, as refugees and asylum seekers, as lesbian, gay and transgender people whose families have disowned us, people who've been in prison and institutional care, sex workers, our stories as working class women, as young black men, as war veterans, as survivors of exploitation, discrimination, displacement. Colleagues, exploring the collective nature of our experiences is fundamental to understanding how social exclusion is produced, its political nature. How do we explain why things are the way that they are? Many homeless people have dogs because it increases their ability to generate additional giving. Beggars can be choosers. These statements from Bath Council and from Hull City Council were circulated, discussed, approved, printed, disseminated by people very much like many of us here. They're part of a familiar discourse that invites the public to scrutinise and judge the character, worthiness and motives of people who are poor, people who don't have dogs or children for the same reasons that we do, people who take advantage, who aren't making a contribution, whose behaviour or attitude explain their fate, people we can no longer apparently afford. As Mark Steele has observed, it takes a trained mind, doesn't it, to understand that the people who are robbing us are the poor. Politics produces the problem and builds the defensive architecture that protects privilege, corporate privilege, professional privilege, personal privilege. The spikes of defensive architecture, hard to dismantle, but it can be done. It is being done on the streets and in some of the services represented here. The politics and practice of exclusion. Defensive architecture is also what the economist David Webster has called Britain's secret penal system. Few people know that the number of sanctions imposed on benefit claimants by the DWP now exceeds the number of fines imposed by the courts. The penalties are more severe. Most sanctions are applied to poor people, and they involve a total loss of benefit income. People who are homeless, who have mental health problems, young people, are much more likely to be sanctioned. How we understand what we're helping people with. Of course, we want to see greater integration. Mental health services that understand homelessness and housing, that don't put up keep out signs, and homeless services that respond to psychological need, that provide the psychologically informed support that is essential to the kind of care that Professor Halligan referred to. It's vital that services offer people the chance to talk about their experiences and to make sense of what has happened to them, and to do this without imposing any one particular framework for understanding or making sense of what has happened. At the same time, colleagues, the use of psychology isn't always benign. We need to be alert to psychological coercion in workfare, in public health, psychological conditionality, what you have to believe, and your attitude is conditional on receiving help, and the rise of psychological fundamentalism. So many roads, so much at stake, so many dead ends. I'm at the edge of the lake. Sometimes I wonder what it's going to take to find dignity. We're familiar with all this, too familiar, the relationship between deprivation and homelessness, between adversity and mental pain. So let's ask the question in a different way, to try and expand the range of people who are listening. What trajectories of power, privilege, income and wealth, what histories of poverty, discrimination, deprivation and disadvantage have resulted in our different fates? As we meet in this hostel, this clinic, this food bank, this A&E department, this doorway, what explains why I'm here and you're there? You've no idea how strong the pull to feel worthwhile is, more basic than food. Linda Tirado, hand to mouth. The processes of social exclusion, what matters more, money or love? Understanding mental health, the social, the emotional, the spiritual dimension of what it means to be human, has immeasurably deepened our understanding of the social determinants. Yes, material circumstances, but also control, political voice, as Professor Halligan mentioned, the freedom to live a valued life. There's a difference, isn't there, between starving and fasting, although the physical manifestations may be the same. A greater focus on mental health is part of wider efforts to capture the missing dimensions of poverty and the experience of poverty, the pain of being made to feel of no account. Sen talks about the ability to go about without shame as a basic human freedom. International comparative studies show that status, the respect I do or don't see in your eyes, control, influence over the things that affect our lives, and affiliation, sense of belonging, are universal determinants of mental health. All services need to pay more attention to the impact of injuries to these needs. For many of us, this meta-analysis of over 145 studies on social support and reduced mortality risk is the water pump cholera moment. We can see here that someone to turn to, a sense of belonging, are on a par with smoking and exceed, are more important than alcohol, physical activity, and obesity. This and a growing body of research, notably in epigenetics, is helping us to understand how social risk, the painful experiences associated with social exclusion, get under the skin and influence physical health. Barriers to social inclusion are a major public health issue. The question is, where are those barriers located? The rhetoric and the reality. In toxic times, perhaps the quality we most need is courage. One of our most challenging tasks is to be the ones who expose the contradiction between a policy commitment to mental health, to parity of esteem, to closing the gap, to addressing serious shortfalls in quality and safety in psychiatric hospitals, in mental health provision for children and young people, the gap between all that, and a politics of austerity that is targeted at those whose mental health is most at risk, that pushes people living hand to mouth, further to the margins. And colleagues, coping with this cognitive dissonance damages our own mental health too. Where is the recovery model for the society of sharks? Reboot our souls or find a new system? Many of you here are involved in making waves and turning the tide, and the evidence shows that services can make a significant contribution to reducing inequalities, notably when they respond to the context of people's lives. We need services that are both psychologically informed and informed by an understanding of the social determinants of health. There's an especially strong case for specialist welfare advice, for criminal justice liaison and diversion, for housing first, as you heard last year, a major scaling up of peer support, always having access to someone who knows what you're going through, what you've been through. A workforce that includes a high proportion of experts by experience. Some of us need to step down, others of us need to step up. And individual placement support around employment. And maybe somebody can inform the DWP that the evidence supports wages, not workfare. Questions of power and privilege can't be avoided, but there are opportunities every day and at every level for expressing the solidarity that is a solvent of exclusion. Recognise me, I'm like you. If we don't know from our own experience about precarity, we can make sure that those who do know around the table are able to be around the table. We can refuse to proceed without them. Colleagues, remembering that baby, we can also resist and challenge language that blames and shames people, that stigmatises dependency and need. Dependency is a feature of being human, what it means to be human, not a moral failing. Have pulled out of presentation on rising prison suicide at the Ministry of Justice tomorrow after being told not to refer to falling staff numbers, #HowGovernmentWorks. How do we explain why things are the way they are? We're commissioned to build the resilience of individuals, families and communities, not to tackle obscene greed. To support behaviour change, not to ask whose behaviour needs to change. But like Lewis Appleby, we can still bear witness, as many of you are doing, and I think you'll become Aidan now, speaking truth to power. In my final observations, colleagues, I want to suggest that we also need to think more deeply and more creatively about who our partners are. The biggest driver of change will be the emerging partnership between the mental health user survivor movement and those with lived experience of homelessness. The bubbling up of activism around housing and disability rights, the Mental Health Resistance Network and their fabulous slogan, "We're bonkers, not bankers." Some of the most important thinking is coming from precisely those groups whose welfare dependency is most decried, whose behaviour and existence is most stigmatised. Thinking on rights-based approaches to food, shelter, income, questions about the fetishisation of work and the devaluing of all other contributions, the refusal of spoiled identities. So many times will you be killed, so many will you revive, so many years will you spend despairing, and at that moment of shipwreck and of darkness, someone will rescue you to go on singing, singing in the sun, like the cicada. This song by Maria Eleanor Walsh, sung by Mercedes Sosa, became an anthem of struggle and resistance during the Argentinian dictatorship. Among other things, it describes a particular gesture, an expression of help and solidarity in our moments of greatest need. At that moment of shipwreck and of darkness, someone will rescue you to go on singing. Colleagues, our need for each other, the gift of our dependency, the strength we find to go on singing in toxic times. Thank you very much for your attention.